Good morning.
Hey, Sharon.
Hello. We are about to get started. We were looking for our speaker for the day. I'm sure we're trying to contact her now, Alice Jordan Miles. Hopefully she will be logging in shortly. I want to thank you all for coming. I'm sure some others will be streaming in just a few moments as the meeting gets started. But I want to go on ahead and get started because it is 10:01, and we do like to start right there on time. So for those of you who are unaware, who don't know me, I think we've got some people here for the first time. My name is Sharon Tubbs. I am the Director of HealthVisions Midwest. And I can see I still have one earring in. I forgot to take that out. I lost my earring, y'all. And then I need to take this one out, and I didn't. So excuse me for the lopsided image. But I do thank each of you for coming out. I want to say, okay, so our speaker is having some trouble connecting. She is working on it. She is on the way. While she gets prepared and gets connected, I want to invite those of you for whom this is the first time that you have logged into our Allen County Health Equity Coalition meetings to introduce yourselves. Or this is the first time in a long time. So you know we are unfamiliar with you. Some of the people don't know who you are. Please just go on ahead and introduce yourself. Who's going to be first? I see some new names here.
I'll go first.
Okay, Valerie.
Hi, my name is Valerie Caldwell, and I'm with the East Central Indiana Area Health Education Center, or AHEC. So I know a lot of you have worked with my director, Justin Tobias. So I am the assistant director. I work with Justin at the collegiate level. So I work with college students, and I manage one of our main fellowship programs. So he's unable to be on the call today, so I'm jumping in on his behalf, and I might jump in here in the future. So thanks.
Wonderful. Justin was a great help to us just this past weekend at our Mental Health and Wellness Expo at Come As You Are Community Church. Thank you, Valerie, for coming. Who else? Who's going to be next?
I can go next.
Okay.
Lupita Valdez, I work for HealthVisions Midwest Fort Wayne, and I'm the bilingual community health worker. I work with the Latino community.
All right, now Lupita is not new. She comes to every meeting. So we want to, of course, we don't need to welcome her because she works here. Thank you, Lupita, for telling everybody who you are and refreshing our memories and our minds about your good work here at HealthVisions. Now, anybody who is new, you've come for the first time, or you haven't been here in a long time, want to introduce yourself? First time or haven't been here in a long time?
Good morning. My name is Tamika Saunders, Community Relations Specialist with United Healthcare Medicaid. We do provide Medicaid coverage to, for the aged, blind, disabled population, foster care children and wards of the state. And this is I'm a first timer. So thanks for having me.
Tamika, we are glad that you've come and joined us this morning with United Healthcare. Thank you. And I saw Kimberly was trying to get in there. Kimberly Diorto.
Yes. So it's not my first time attending. I was present at your in-person meeting last month, but I might be a new face to some people still. So my name is Kim Diorto. I am the director for the new Northeast Indiana Area Health Education Center that's at Goshen College now. So I worked with Justin Tobias and with Valerie previously. And so that 17 county region has now split. So there's now East Central Indiana AHEC and Northeast Indiana AHEC. And so Allen County falls into the region that I oversee now. So I just wanted to, introduce myself to people that may not remember me from last time or that I'm new. So I'm hoping that we can find ways to work together in the future.
Wonderful. And Kimberly, I think Tamika may have said this, but for those of us who are unfamiliar with the term AHEC, tell us what that stands for.
So that's Area Health Education Center. Okay. So our main mission is to promote healthcare careers and address the health profession shortages in a variety of ways and different programs.
Okay, awesome. Anyone else? This is your very first time or you haven't been here in a while. Marquita?
Marquetta, yes, good morning, everybody.
Good morning.
I am so grateful to be here. Thank you so much, Sharon, for inviting me and allowing me to be here. I'm excited about it. But my name is Marquetta Brapson William. I am a licensed sales agent with Humana. I don't normally sound like this. I am so sick.
Oh.
I have a little cold. It's not COVID, but thank God. So I got a little laryngitis, but so I serve Allen County and Adams County. And again, I'm happy to be here and I'm looking forward to learning about all of you and what you do and how we all can get together and help those in our community with any social determinants, and things of that nature. So thanks for having me.
Thank you so much, Marquetta. Anita, you have your hand up? Or was that by accident?
It was not. I'm
Okay.
introducing myself. I just practice protocols of face media. So I'm Janita Washington, Fort Wayne Housing Authority Director of Programs, and I haven't been on for a while, but I've gotten on before. But I just want to say good morning.
All right, thank you, Ms. Anita. Anyone else for the first time or haven't been on in a while? Okay. Well, we are grateful that each of you is here, and we welcome you into the space. I forgot in my discombobulated state this morning that we start each of our meetings with a meditation. For those of you who are unfamiliar, HealthVisions Midwest is a faith-based agency. We are owned by the Poor Handmaids of Jesus Christ. That does not mean that we are restrictive. We certainly welcome any and everyone to our meetings, and we serve any and everyone that we can that falls within our mission. But we do start our meetings with a meditation or prayer. And so if you are not one who likes prayer or just not down with that, feel free to turn down your volume right now for about 30 seconds or so. And then come back to us, and that will be just fine with us. Patricia Beasy is going to lead us in this morning's meditation.
Good morning, all. As she said, my name is Patricia Beasy, and our meditation today is called Be True to You. As you set out on life's road, unsure of the path you'll go, the most important thing you can do is always be true to you. Always remember who you are in moments of struggle or fear. Never give up on the hopes and dreams you hold dear. There will be setbacks and rejection and moments of failure too. But you must overcome any frustrations to achieve the potential of you. Don't forget to smile or to laugh or to live in the present. No matter where life takes you, make every moment pleasant. As you travel along your journey, know that you're never alone. He will always be here for you should you need the comfort of home. End of meditation.
Thank you so much, Patricia, for that.
You're welcome.
I like that. He will always be there for you. And so sometimes we feel all alone in the work that we do, feel that it might be useless sometimes because we feel like we're not getting anywhere. But that is not true. We are not alone. And also, I want us to keep in our thoughts and prayers the people in Texas after the mass shooting at the elementary school. As a matter of fact, let's just take a moment of silence. Let's take about 30 seconds or so just to pray in our hearts and think about those families that have been affected. Thank you, God, for healing and your comfort and power. And we pray that you would comfort and heal those families and help us as social service agents in this community and in this nation and in this world to make a difference. Help us and hold us accountable to the work that you called us to, so that we can love others to the utmost, just as you love us. Amen. So thank you all for that. If you have turned off your volume, please come back. That's me waving, saying please come back. So without further ado, we want to get to the agenda that we have before us. We have a very exciting presentation today, and exciting, by exciting, I mean enlightening. I know that Alice Jordan Miles, I have seen her speak previously. Many of you know her, and her work is phenomenal. And she has been in the trenches for a long time, for quite some time. And one of the things that I love about her is her transparency. Alice, are you able to share your screen?
Yes, thank you. Hold on one second.
And so I want to introduce her just very briefly, because just in the interest of time, I know she's got a lot to share. Alice Jordan Miles is the director of Purdue Fort Wayne's Behavioral Health and Family Studies Institute. She comes to us this morning talking about a new initiative, or I think it's been in the works for about a year or so now, but it may be new to many of us. We wanted her to come and discuss Bienestar Sin Fronteras. I think I said that kind of okay.
Very good. Bienestar Sin Fronteras.
Wellness Without Borders. This is Mental Health Awareness Month, and HealthVisions has done several things, several programs and events around this. And so we thought, what better way to conclude this month, or our activities this month, with a presentation by Alice Jordan Miles and this new initiative. So Alice, the floor is yours.
Thank you so very much. And hello to all my friends. I see a lot of friendly faces on my screen here. So thank you to everyone for having me. And I do so appreciate the moment of silence we just took for our brothers and sisters in Texas. Again, my name is Alice Jordan Miles. I am the director of the Bienestar Sin Fronteras, which means Wellness Without Borders. First and foremost, I would like to take this opportunity to thank, most importantly, our funders, because Bienestar would not be what it is today without the grave donation and support from the Lutheran Foundation, the St. Joe Community Health Foundation, DAC, Allen County Drug and Alcohol Consortium, and of course, Purdue University, Fort Wayne. Just as a caveat, I just want everybody to know that I'm a very proud IU alum. So it's really hard to wear my black and yellow, but nevertheless, my check cashes very smoothly, so I can't complain. But nevertheless, thank you all for inviting me to share with you about the great work about Bienestar Sin Fronteras. How a dream became a reality. I have been in the field of mental health for over 13 years. I got into the field kind of by accident, but I am a person who suffers from depression each and every day. I am a suicide attempt survivor. At the age of 16, I attempted suicide, and it really, as of late, and because of my therapy with my therapists and other self-care that I have recently been involved in, a lot of things in my life has come full circle. I like to use my transparency, my platform, to share with everybody that, you know, it's okay to be okay, but it's also okay not to be okay. And when we are in the field of mental health, it's important to share your journey, because you never know what your journey and the impact it will have on others in regards to saving their lives. So in my work of mental health, I've always had a focus on communities of color, but specifically in the African American community. But when I turned 55 last year, I am a person of faith, and me and God had a really good conversation. And I said that in the next, and hopefully the last 10 years of my professional life, I wanted to be very intentional. And what I meant by that is meeting the needs of my people, the Latino community, because very often I am approached by individuals who want to work with the Latino community, see the need, see the trauma they're experiencing, but because of their citizenship or lack of, there are very little, if any, services available for individuals who are not US citizens, especially from the Latino community. So long story short, United Way approached us pre-COVID and asked us to write a grant. Unfortunately, and I gathered a whole bunch of Latino leaders together. My life was put on hold for 3 weeks, in which we wrote a very extensive grant. And unfortunately, that grant was denied. Lutheran Foundation later on, a couple days later, called me up and said, "Hey, Alice, we heard you got denied. We want to fund Bienestar Sin Fronteras." And folks, let me tell you, that was like somebody saying Oprah's on the phone, because the United Way, right? The Lutheran Foundation has committed to 3 years of funding, which equates to almost $750,000 over a 3-year period, solely for the benefit of Latinos in 9 counties, Allen County being one of them, and the other 8 counties that the Lutheran Foundation serves. And that's how Bienestar became of, based on a dream, based on individuals who never gave up on this dream, and also very grateful to the Lutheran Foundation as well as the St. Joe Community Foundation. Latino communities and mental health. You know, I can tell you from my own very personal experience, my parents, we never talked about my suicide attempt. As a matter of fact, it was only about 5 years ago that I asked my mom and my dad about it. And it was, over 40 some years later, we never even talked about it, because in the Latino culture, and let me say something before I keep on going. I don't mean to generalize. I come to you, I speak to you from my own journey and my own experiences. But there has been a stigma and taboo around mental health in the Latino community, that you don't talk about mental health. And frankly, my family, specifically my parents and my grandparents, when I attempted suicide, their thought was that I had sinned and God was now punishing me. Silence compounds the range of experiences that Latinos and I felt. You deal with the immigration, the trauma, the generational conflicts of, how we view, how we embrace, and how we receive mental health. And of course, we as a society, as a community, have unique institutional and systematic barriers that impede the access to services. And fortunately, because of funding received by the Lutheran Foundation and the St. Joe Community Foundation, we're trying to exclude some of those barriers in our community. Prevalence that has shown that among older adults and youth are more susceptible to mental health because of immigration, and also wanting to have the American life. I am full-blooded Puerto Rican. Yes, we are United States citizens, but when my family came here from the island, they came here solely so that their children would have a better life. And many times I wanted to have and live the American dream when I was a teenager. I wanted to play the American sports. I wanted to go to the American prom. I wanted to have the American boyfriend. But at 3:01 each and every day, my sole responsibility in my family was to be a caretaker for my younger siblings. I come from a family of 14. I am an only 2 girls, 12 boys and 2 girls, and I was the oldest girl. And my sole responsibility was just to take care of my younger siblings. And that really played and had a very negative impact on my teenage years. I saw no purpose. I saw no focus other than being a caretaker for my younger siblings. major depressive episodes increase, and it has increased even among Latinos within our community. Our suicide numbers in the past have never included Latino suicides, but in the last 2 to 3 years, our numbers have exceeded to 2 to 5 to 7 suicides per year from the Latino population. There are many issues that Latinos face. Unfortunately, young people who have been diagnosed or undiagnosed because of ADHD, autism, is often referred to as being disruptive behaviors, other than them getting to what the sole need of what that particular young person is needing. Mental health problems can be hard to identify, especially among the Latino community, who often focus on physical symptoms versus actually giving it the name that it rightfully deserves. Poor communication with healthcare providers is also an issue. One of the proudest things that I am about Bienestar Sin Fronteras is that all my therapists are native-born Spanish-speaking therapists. So it's so powerful that the clients that we serve, the therapists look like them and speak to them in their native language. And that's so important when it comes to meeting the needs of the Latino population. This is from the the Youth Risk Behavior Survey. It's from our state of Indiana. And what makes this particular survey so powerful is that all this information that is gathered is self-reported. So for example, I was one of the administrators of the past risk behavior survey. And what we do is we bring a pamphlet of questions, and we bring the old school sheet of, you fill in the ovals, and questions such as, do you wear a seatbelt as a teenager? Do you chew tobacco? Do you smoke cigarettes? Do you vape? Have you thought about suicide? Have you been depressed in the last 2 weeks? Questions of that nature. But these results are all self-reported results, and results that we as a society, and we especially in the health field, need to pay special attention to. So as you can see here, the question here is that these are students that reported that their mental health was most of the time not very good, including stress, anxiety, depression during the 30 days before their survey. As you see here, the percentage was for Latinos, was 32.5%. And when you broke it down, 20.2% were males and almost 50% were females. Another alarming statistic among our Indiana youth was the percentage of students who seriously considered attempting suicide. Again, I bring your attention to the Latino line. Close to 20% seriously considered suicide. And again, the number for females was higher than males. This is very alarming. Percentage of students who made a plan in taking their lives. Again, almost 20% of Latino youth and a quarter of Latino females made a plan in taking their life. Furthermore, students who actually, again, self-reported, who actually attempted suicide. And again, folks, this isn't data from 2020. From like 2015, 2017. This is 2021, just last year. Close to 20% of Latino females had actually made an attempt. And just like my graces of God and whatever their higher power, they're here to tell us about it. So there are many challenges that we have encountered working with this program. even before we even got started. Nothing like this has ever been put forth in our community, or even in the research that our group looked at. There was no program that was being funded 100% non-governmental funding that was its target audience were Latinos who necessarily are not welcome into our community by all. There's no footprint for us to follow. Setting up electronic records with our data collection company has been a big challenge. Finding therapists who are number one Latino and number two are bilingual. So much so that half of my therapists do not even work in this area. Therefore, we're having to provide telehealth, which many people, including myself, hate. Males do not like telehealth at all. It's hard to get them into an appointment, let alone to sit in front of a computer and talk about their mental health, when society and our culture has told them we never talk about that because that shows a sign of weakness. Stigma and taboo around help-seeking behaviors continues to be a challenge from day one, as well into mid-day, how would I say this? Into mid-year, our second year of our program. Lack of resources for our undocumented population, because what we're discovering is that when we're providing these therapeutic services, it's almost like peeling away an onion, because the trauma is so intense and it's been so buried by other things, by what our culture tells us to do, that it is all coming out together, or coming out at one time when they're meeting their therapists. And understanding that many of our parents do not have health insurance, but their children do. So Bienestar provides 3 types of therapy: family, individual, and marriage. Because I'm trying to be very frugal and very good stewards of our dollars, we do not provide services to Latino individuals who have Medicaid. But when we have a family and we're providing family counseling or marriage counseling, sometimes we have to bring the children in. And when we bring the children in, they have Medicaid. So we're kind of going behind the wishes of our funders. But believe me, I do ask, and I make sure I report that in my monthly report. But it kind of puts a bump in the road of providing that continuity of care to the entire family unit. Let's see, what else? Also me, I have no clinical background. I just have a passion and commitment to mental wellness. And I've learned the hard way that I need to stay in my lane because I don't know about, what are the requirements of therapists, what is considered unethical. I want everybody to come together and understand and appreciate the services that we provide, and bringing, some of the clients together. And, some of my therapists like, Mrs. Miles, you can't do that. We can't impede on their safe space and their comfort zone. So it continues to be something that I have to understand, that I need to empower my staff, and I hired them for a reason. I need additional Spanish-speaking native-born therapists. The overarching of cultural stigma towards mental health continues, but I do believe in my whole heart that we've made an impact in Allen County and various other communities that we serve, because we are starting to change the culture, as well as the cultural lens, how we view and embrace mental health. Lately, though, however, just today, I just got off the phone because of what happened in Texas. A lot of our clients have been triggered, requesting emergency appointments by my therapeutic staff, which is very understandable considering what has been being played on the media over and over in the last, 18 hours. So our mission is to address and minimize disparities of mental health, access to the uninsured, underserved Latino population, And I say this, we start off every meeting by revisiting our vision and reiterating to encourage and normalize help-seeking behaviors to promote and encourage mental wellness. Our services, as I indicated, is that we do provide counseling. We have a podcast. One thing that I'm finding out that there's a big generational difference on how our people look at mental health. Second and third generation tend to embrace it more, whereas the old timers, if we will, or the seasoned individuals tend to look at this still as a taboo, and that, how dare us to start, talk about our mental health outside our home. I am training 10 Latino leaders, the ladies of the church, if you will, ladies who are making the funeral dinners. These are individuals who are not necessarily on boards. These are individuals who are at the grassroots level, meeting the needs of our community. I'm going to train them to be trainers in QPR, question, persuade, and refer, a suicide prevention program, as well as obtaining funding to get them to be trained as mental health first aid trainers so that they too can go out and train in Spanish. We do have a support group. We have 3 of them, as a matter of fact. It's called El Poder de la Mente. It's ran by Gladys Calderon. We have partnered with Southside, Bishop Luers, and Abbott Elementary School, in which we've had weekly support groups with our young people that encourages help-seeking behaviors, and also encouraging and providing them the language to start to encourage the conversation at the dinner table, or when their moms, when they're around in a community, when they're making tortillas, or at a family quinceañera or a family baptism, to start talking about mental health, not in a bad way, but in a positive way. We've also put together public service announcements that are being played at all our Allen County libraries. And we also have a video that has been developed. And one of the proudest things about Bienestar is our website. I encourage each and every one of you to visit it. It's bsfindiana.org, bsfindiana.org. Everything on there has been culturally translated by Language Services Network. That is the funding that we receive from the St. Joe Community Foundation that pays for all translations on our website, as well as any other translations that is needed when serving our clients. This is my team. Again, as I mentioned, we have therapists, but half of them are not even from the Fort Wayne area. And I only have one male therapist, Rolando, and he's out of the Goshen area. We do have support groups, as I've mentioned. We will be expanding our support groups next academic school year. And one of the things that came out of El Poder de la Mente is a parent group as well. One of the things that we found out that our students were coming back and telling us is that, my mom doesn't understand why I'm meditating. She thinks I'm on drugs. My mom doesn't understand that journaling is important. These are kind of things that our culture really never visited or even considered before or been introduced before, because whatever our thought process, I'll never forget when my mother would, I was talking to a cousin one time and about, being depressed. And I remember being grounded for a week because I had spoken to someone about my mental health, because it was so shunned in my family. One of the things that El Poder de la Mente does is that we expose our young people to activities that they otherwise may not experience, like ice skating. That's a healthy health coping skill that they can embrace and practice when things may not be going great during the winter months. We're taking them kayaking. It was we were supposed to go last week, but unfortunately the weather didn't participate. We take them to events at the Embassy Theater. We do, you know, the progress board, the bulletin boards. There you can see a picture there, and also doing activities that show kindness among one another. So again, we're introducing them to things that they otherwise would not have the opportunity to do so. These are the Allen County statistics, suicide statistics. And as I mentioned before, Latino suicides were pretty much non-existent 5 years ago. And unfortunately, over the last few years, those numbers have increased. This is my podcast team. This was our first episode that was recorded. And it's called Bienestar Without Borders podcast. And we're working on getting it on Spotify. I didn't realize there were so many things that we had to do to get on Spotify, but nevertheless, we talk about a lot of great things. We've already had a young person write in and tell us, thank you for being so transparent and letting her know that she was okay to have the thoughts that she was experiencing and that she wasn't weird like her uncle had told her. So here are our highlights from year one. And I must say, I'm so proud of my team. We had a total service of 420 clients. And we only had 2 that were discharged and 20 over a year that did not show up. And I think that's pretty darn impressive of considering that many of our services or sessions were provided telehealth. As you can see, that there were more female than males. We started counting non-binary, and we didn't start doing that until way into our first year. Our range of services was 8 to 69. We did 420 evaluation intakes, but as you can see here, and this may be misleading, it states here that we had 1,050 therapy sessions. This number needs to be broken down even further, but unfortunately, when we started this, again, there was no blueprint. But this 1,050 reflects the number of times we were contacted by the clients that we serve to provide additional services beyond the therapeutic services. And in our year 2 highlights, we will have that broken down even further to have a clear indication or a reflection of the number of therapy sessions that we had for the clients that we served.
Alice?
Yes, go ahead.
Yeah, we are running out of time if we want people to ask questions. So I had one quick question about the screen that you just had. You said we started out with non-binary. Can you explain that, just that term for people who may not know what you're talking about?
Yes, exactly. What we did, when we had our clients filling out our application for services, we were finding that some individuals were not indicating male or female because those were the only 2 boxes that we had provided. So we now put, I think how we phrase it or coined it, rather not say transgender, gay, lesbian. I believe that was the other 3, and also binary.
Okay, thank you. Did you have a few closing things?
Yes, I do. I want to say a very special and sincere appreciation to, Fernando Cepada. He is, how would I say, he is the Chuck Surack to the Latino population. He has been, his platform alone, he gives us so many hits. When he puts all our information on his Facebook page, on his monthly newspaper, El Mexicano. We have, unfortunately, We have over 400 people on our waiting list.
Hmm.
And I told Fernando, I never thought I'd ever say that I didn't want more marketing, but I don't want any more marketing because we need to get more therapists. The need is even greater. And just alone this morning, we've had 11 new inquiries just to get assistance with immediate therapy. This is my team. Nothing is impossible. This isn't about Alice. This is about them. This is about them. And I'm very, very appreciative and grateful to God that they've stuck by me and they're meeting the needs and they're working very intentionally for the Latino population. Any questions?
Yes, I have a question.
Sure, go ahead.
I've been trying to assist some of my clients to get the services. So then I've been doing some calls over there. And when I call, they tell me like they are full at the moment, but I've been asking them if they have a waiting list where they could put my clients until there's a spot. And they has told me there's not waiting list and I need to be just keep talking.
Did you complete an application?
No.
Okay,
I asked
so
them like what I can do for start the services or a waiting list or something where I can sign them while they are waiting. They say, no, you just keep calling.
okay, what I need you to, can you put your email in the chat box for me right now? Because that is not the process at
Thank
all.
you.
So
Thank
I
you.
will get to the bottom of that. And I apologize for that, but I can tell you that the wait is long and that just goes to show you the need of the Latino population.
I know it. I've been working with Christina.
Yes, Christina Sanchez. Yes.
Yeah, yes, she has referred clients to my program. So then, and she's doing pretty good job. So then I just want to
Thank you. And it's overwhelming. I mean, we hate to turn people away and we hate to say to them 3 to 4 months down the road. But, you know, and a lot of my therapists, all but one have another have their own full-time job.
I understand.
Any other questions?
Alice, much of your presentation focused on youth, but you also serve adults, correct?
Oh, yes, we serve adults as well. We do individual, marriage, and family counseling, no matter the age.
And how can we as social service agencies and representatives from various agencies, be they social service or other, in the community, how can we help? What can we do to help this effort?
First and foremost, if you come across a Latino therapist that is bilingual, please bring them to my attention. In addition, if you come across a Latino therapist that isn't bilingual, but is willing to join our team, please bring them to my attention, because we are also finding out that second and third generation Latinos would prefer to have their therapy in English versus in Spanish.
Mm.
But understanding the culture is so critical to the success of their mental wellness.
Are there any other questions?
And if I may say, and also one more thing, if you know of young people who are in college, especially our Latino brother and sisters that are wanting to go into mental health, encourage them to do so. And please connect them with me, because there's been some behind the scenes work going on that we're trying to raise scholarship dollars for them to go on and get their master's in counseling. Because that truly is an obstacle for many that want to go into the field, but they can't afford to go on to grad school because of their status. They're not able to get a Pell Grant. They're not able to get any governmental assistance for their college education, and they don't want to take on any additional more loans. So I ain't mad at them, but let me see what I can do to assist them and get them connected with the right people so that maybe they can be under a sponsorship or something of some nature so that they can pursue a degree in counseling.
Alice, it seems as though the comments are all, what an incredible and awesome presentation. You have given us some wonderful information and a resource. You pointed out a resource that some of us may not have known existed. One last thing that I wanted to ask, you mentioned funding for 3 years that you've gotten, I think, from the Lutheran Foundation. What happens after that? Because you started last year.
That is the big thing. I mean, I'm already trying to raise money to keep the program sustainable.
Yeah.
But I don't have an answer to that. I don't know. I really don't know. I just hope and pray that the Lutheran Foundation and also other foundation and other philanthropic endeavors will hear of us and see the work that we're doing with the minimal therapists that we have and the impact that we've had, considering the fact that, this has never been done before. And this program is very fluid. I'm learning and changing things daily because of things that we've never considered when we thought about this. So nevertheless, it's very fluid, and I hope and pray that something will come through, and hopefully that, the Lutheran sees the worth of their dollars and that we're doing good work. So please pray for us. That's another thing you can do for us, is pray for us.
Well, it's obviously crucial and a much needed effort in the community. You've shown that with the data that we were able to see. Would it be okay if we were to get your slides?
Sure, absolutely. I'll send it to you right after I get off here. And then I will also include my contact information so that people can contact me directly. As well as I'm going to include a very, very good website that if you have clients of Latino descent, I will send you that particular website. It's the Midwest Latino Technology Center. It's a plethora of information, plethora of resources that is even already translated in Spanish.
And someone did ask for brochures, and we're going to give them your contact information so that if you have some printed materials and things like that, that they can connect with you and get
absolutely. As a matter of fact, I will have Christina drop them off personally.
Wonderful. Okay, so as
thank you.
Yes, thank you. I knew that we would be enlightened this morning with this presentation, and so I'm so glad that you came. Thank you so much. We are grateful.
Thank you.
And so now, as we do each month, we want to turn to our remarks from agencies, and we want you to tell us, our partner news, what's been going on. I, of course, want to tell you what's been going on with HealthVisions Midwest. Like I had mentioned earlier, this was Mental Health Awareness Month, or is, it still is. We still have a week to go. And so we have done a number of activities. One of those was the Mental Health and Wellness Expo, which some of you did participate in on Saturday, which was a great success. And we had a number of people come out to that for screenings for some of the mental health workshops. And so that was a good time. We've had an Aspire series about trauma and healing all month. And that is still going on. The last session, I believe, is tomorrow, Patricia. Yes, okay, she's nodding, yes. Is there anything else that I'm missing that is coming up? Any of my team want to mention something that we've got coming up? We don't have anything coming up, y'all? Okay.
I think the only thing that we have is, in June, we'll kick off our next Aspire series. So look out for that next flyer coming out.
And that will be on employment and how to interview and be on the career path that suits you. Okay, so now we will turn to our partners. What is the news that you have that you want to share with everyone? So come on, partners. This is your time. This is the place. Tell us who you are, who you represent, and what your news is. Give a brief shout out for something that is upcoming.
Hi, Sharon. It's Kiona. I'll go ahead and go.
Yes.
Okay. For cancer services for the month of June coming up, I still have the low impact Zumba classes on Tuesday, every Tuesday. And I also am bringing in a Reiki speaker this time around. And Kandra, she'll be doing a story time for the month, and then still the yoga. And I think a lot of people seem like they're kind of afraid of yoga a little bit, but you know, but to not be, because yoga is basically a lot of stretching, and we need a lot of stretching, especially if we exercise and things like that. So I'm trying to kind of get that out as well, to not be afraid of that. So that's for cancer
Thank
services.
you, Kiona. Yeah, cancer services. Yeah, yoga can be intimidating. She said it's stretching, but it's some hard stretching. It's not just a soft stretch. But that is it's really good for you. So thank you so much for that. We encourage you to attend that. Colleen, I see your hand.
Hi, guys, or gals. It's great to be here. And wow, Alice is a rock star.
Yes.
I want to first of all say I've been doing yoga for years, and it kind of depends on the class you go to. And I think Kiona was talking about it being more stretching, which that's the kind I like, is like the slower stretch version of yoga. But some people do yoga as exercise and it's fast paced. And I think that's the stuff that people assume and get intimidated about. But the slower stretching stuff is fantastic.
Yeah, Diane is just trying to get more of the stretching incorporated in there. Diane
love it.
Rogers.
Oh,
So
good. Thank you.
Thank
So
you.
do not be intimidated. Don't think about what I said.
Yeah.
Think about what Colleen said and go. Ahead,
but
Colleen.
I also wanted to put out there that I'm having an ASSIST training, and ASSIST stands for Applied Suicide Intervention Skills Training. So this is for folks in the field that tend to find themselves in position where people turn to them when they're in crises, especially crises that could be related to suicide. It's a 2-day training, but it's very experiential and hands-on. It's not like the death by PowerPoint that some longer trainings are. And it's about helping someone who is thinking about suicide and wanting to die move to a place where some part of them wants to live and they're willing to make a safety plan and stay safe. And given the shortage of mental health providers that we have out there and the long waits for mental health appointments, it's really important that every organization have at least one person trained in suicide intervention, because even if someone is thinking about suicide and they are willing to go get help, it may be weeks before they can actually get into someone. And so a suicide intervention not only is this, listening, therapeutic kind of listening approach, but there's a safety plan that people learn how to do to help someone stay safe in case there's a delay in getting mental health services, or maybe they've had a bad experience with mental health services and they're not willing to go. So it's important that everyone can, every organization have someone trained. I know Lupita has attended, and I would love to have you all there. So I will send the flyer. It's June 8th and 9th. Holy Cross is holding it, but they're opening it up to the whole community. It's $200, and I'll send the flyer to Felicia to send out. And yes, I'm excited that we're holding this again. So if you have any questions when Felicia sends it out, my email and phone number will be on there, and you can just contact me.
Thank you, Colleen. Yes, Lupita is trained in suicide prevention for our agency. And so, like Colleen was saying, that's a wonderful point. We just heard Alice talk about how the waiting list is 400 long for their services. How great it would be if we all had someone trained in suicide prevention at our agency.
And anyone can do it. You can be a parent that, is worried about a relative that they are always, a support for. You don't have to have any kind of official background to take this course.
Excellent. Who else has news to share? Nobody has anything to share? Y'all don't have anything going on? Well,
Hi, Sharon.
Okay.
Hi, Sharon.
Yes,
is
Carla.
hi.
Yeah.
I wanted to share that I'm hosting the partner fair, the Indiana State Department of Health, Office of Minority Health on Tuesday, June 14th from 10 to 12 at Stillwater Hospice. And this is a fair that will engage knowledgeable organizations who can help our community address COVID hesitancies and other health disparities. And if anyone is interested in joining this fair, I will put my email in the chat box. Okay, thank you.
Wonderful. So Carla's doing some work with the Office of Minority Health with the state, and they're going to have this event. Carla, is there a flyer perhaps that maybe you can send Felicia and we can include that with our news and events update?
Yes, there is, and I will send it to her. Thank you.
Wonderful. And we've got some amazing and excellent news in the chat. Come on now, everybody, give it up for Maggie with the Alzheimer's Association. Yay. For those who have not seen that or can't see that for some reason, Maggie will be done with her final chemo treatment next Friday. And she will officially be cancer-free after 15 months of treatment. Yay. So let's give her a big shout out. This. Woo-hoo!
Yay, Max.
Yes, awesome. So we've been thinking about Maggie and through this journey. And Maggie, we just want you to know that we support you, we love you, and you will continue to be in our thoughts and prayers. Okay. All right, are we going to end on that finale, or does anyone have any other organization news that they want to share?
I have something.
Yes, May.
Yeah, so my name is May. I'm the let me turn off so you can see me. It's a little dark.
Okay.
Can you guys still see me?
We can see you.
Okay.
Yes.
So I'm May. I'm from Amani. I just started as an outreach assistant, bilingual outreach assistant with Amani Family Services. And with all the news, I just wanted to share that with our organization, we do have something that is coming up in June 20, the World Refugee Day, 5:30 to 7:30. And it's gonna be at Foster Park. It's on our social medias as well, if you wanted to be reminded. So I welcome all of you guys to come. And
wonderful. World Refugee Day, June 20th.
Yes.
You said, okay, so
at Foster Park.
At Foster Park, awesome, with Amani Services. So you're going to send, I know that you guys have something on that you could send, and we can include that in our news and updates. So we appreciate that. Okay, Irene has put some information in the chat for us. Thank you so much about World Refugee Day. That happens every year. It's a big thing, and we want to support that effort if we can.
Yep, thank you.
Okay. Thank you so much, everyone. I hear or see no one with a hand up, nothing coming forth. So we appreciate you for coming this month. In a couple of days, you will have something very exciting in your inbox. That will be the HealthVisions newsletter. Yes. So don't just dismiss it or discard it. It's going to have some great stuff in there. So we thank you for coming out. Please be on alert for that, as well as for our news and events that are coming up, and for the events that you've heard today. Let's support one another, because that is how we work best, okay? That's really how we get things done. And of course, as all of you will, continue to keep the people of Texas and the folks in Buffalo who are mourning the recent deaths there, and all just our nation in your thoughts and prayers, and how we can come together and love one another, and somehow change the state of things today. Okay? Thank you all. Have a great afternoon.